Everyone. I'm Costa. I work with the School of Cities, and I'm pleased to welcome you all to the November session of Knowledge Café in our 2025-26 season, featuring Mercedes Sobers. Knowledge Café, if you don't know, at the School of Cities, is a monthly speaking opportunity for members of the U of T tri-campus community to present insights and highlights of their research on a theme that is important and relevant to cities. It provides a platform for faculty, students, and researchers who are working to uncover solutions to creating more just, equitable, sustainable, and prosperous cities. Now, just before I introduce our speaker, I'd like to acknowledge the land on which the University of Toronto operates. This land, covered by Treaty 13, is the traditional lands of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit. It continues to be the gathering place of many Indigenous, Métis, and Inuit peoples from across Turtle Island. As we hear about the experiences of Black communities in Ontario and how the Black Joy Art Initiative seeks to center wellness and joy within Black communities, we ask you to reflect as well on the parallel ways in which government policy and prejudice has negatively impacted healthcare access and outcomes for Indigenous peoples across Turtle Island. Now, to give you a bit of insight about today's presenter, this is Mercedes Sobers. Mercedes is a PhD candidate in epidemiology at the Dalalana School of Public Health, as well as the founder of the Black Joy Art Initiative. Her work focuses on the intersections of marginalized or underserved communities and their access and experiences within the healthcare system. The Black Joy Art Initiative explores the intersections between mental health and the Black community. Now, before I turn the presentation over to Mercedes, I'd like to quickly remind everyone of a few housekeeping items. First, you'll notice that all microphones are muted for the duration of the presentation. If you wish to ask a question live during the question and answer period, you can request to be unmuted and a staff member will assist you. As well, you're welcome to use the chat function to type in your questions at any time during the presentation, and we'll collect them and get to as many as we can following the presentation. Finally, we ask that everyone please practice respect and good etiquette. Anyone who demonstrates inappropriate language or behavior will be removed from the session. Now, without any further ado, really excited to hand over today's session to Mercedes. So take it away.
All right. Thanks so much, Costa, and hello, everyone. As mentioned, my name is Mercedes Sobers. Fun update is that I actually recently defended about like 3 weeks ago. So now I'm a PhD, person. So thanks for taking the time to meet and to talk about Black joy and mental health research. And so I want to start off this conversation by asking you, what's a hobby that you enjoy? Picture yourself doing this hobby, whether it's painting, gardening, maybe playing music, or even just walking in nature. That could be a hobby. Why do you do it, and how does it make you feel? So for me, as a public health researcher and epidemiologist, I'm deeply interested in mental health and well-being, particularly among racialized and traditionally marginalized population groups. And so this interest for me comes from a very personal place. As a Black woman, I grew up in a culture that I felt often ignored mental health and minimized kind of the struggles that folks were going through. And I saw how that approach hurt folks in my family. And as I navigated adulthood, I realized that this wasn't just the family phenomena, but many of the beliefs that I learned extended to the broader Black community. And so I was hearing saying and things repeated within larger Black spaces. And so I became really interested in why we experience mental health stigma and distrust towards mental health care, and how we could cultivate healthier mental health practices and relationships. And so this started percolating around the time that I decided to start my PhD, and really rolled over into my doctoral work, where my focus was on mental health service use and self-rated mental health among Black populations in Canada. And so I wanted to better understand this because we actually have remarkably scarce data when it comes to mental health service use and the mental health of Black populations, among other ethno-racial communities as well. So before I really get into this, I kind of wanted to situate us by first talking about what I mean when I say the word Black. So race is a socially constructed concept that has the power to deeply shape the human experience today. However, it's often misunderstood as being something that's biological, There is no biological criteria by which race can be categorized. How race is defined has evolved over the years. However, in Canada, within our current context, I would say that to be Black is most often associated with physical traits and country of ancestry. And so, since race is kind of this socially constructed subjective measure throughout this presentation, when I talk about being Black, it's based on how a person self-identifies. And when I talk about race impacting mental health and mental health service use, that's primarily because of how Black people are treated or experience their Canadian environment, based on how they racially appear. A second thing that I kind of wanted to ground us in is this idea of intersectionality. So this is a term that was coined by a scholar, Kimberly Crenshaw, and it's the acknowledgement that we do not live single issue or single identity lives. We have a lot of identities that are intersecting that shape our experience. And so I am not just Black, I'm woman, I'm able-bodied, I am educated, all these different things. And so as we think about, being Black and navigating mental health or being any other racial identifier and navigating the system, I also want us to be cognizant of how this might intersect with someone who has other identities, things like maybe mental health issues or different abilities to navigate the world or different, or various sexes and genders and sexualities. And so I really like this quote from Audre Lorde that says, "There's no such thing as a single issue struggle because we do not live single issue lives." And within my context, the way I think about this in my research is by thinking about sex and pre-existing mental health. So before I get into the Black Joy Initiative, I kind of wanted to talk about the research that I was doing throughout my dissertation that kind of led me to this place. And so within my research, my question was around how mental distress and mental health service use differed within Black and white populations in Ontario. And that led me to 3 objectives. One was to look at this difference among adolescents and specifically look at their mental health outcomes. Second was then to continue looking at adolescents in Ontario, but look at their mental health service use. And then finally, I moved this beyond adolescence into adulthood and looked at mental health outcomes and service use. To do this research, I used a cross-sectional design, which means that I looked at data from one point in time. The 2 data sources I used was the Ontario Student Drug Use and Health Survey, which I'll refer to as the OSDIS, and then the others, and that was for adolescents. So the OSDIS interviews adolescent age students in high school and middle schools across Ontario. And then I also used the Canadian Community Health Survey, which is used across Canada and collected annually. The OSDIS is collected biannually. So for the Canadian Community Health Survey, I may refer to it as the CCHS. And I looked at years 2015 to 2019. So these are all pre-pandemic years. So as a reminder, my first objective was to understand if adolescents had different mental health outcomes. And what I found was that it really depended on how we measured it. And so there are 2 ways in which the OSDIS measured mental health for adolescents. One was the Kessler and one was a single self-rated mental health question. So with the Kessler, it asked 6 different questions, things like, in the past 30 days, how often did you feel nervous, hopeless, worthless, restless, or fidgety? And then based on how they answered these 6 questions, they would receive a score ranging from 0 to 24. And then there were specific cutoff values that determined if they were in low distress, moderate distress, or serious distress. The other way that this was measured, and it's a fairly common way I find to kind of get a snapshot in population studies of how people's health is a single self-rated mental health question. So you just ask folks, how would you rate your mental health? And then they respond on a range from excellent to poor. So as I mentioned, when it came to mental health outcomes, it really depended on how we measured. When it came to the Kessler, we found that in general, Black students, adolescents had slightly higher odds of mental distress. However, there was effect measure modification. And what that means is, when we bring in this intersectionality piece, the effect of race on the outcome of mental health was modified by whether or not they were a boy or a girl. So among Black boys, they actually had a lower odds of saying that they had mental distress or screening for mental distress on the Kessler. But then when it came to Black girls, they actually had a much higher odds of being in mental distress. However, when it came to the self-rated mental health question, when we simply asked students, how would you rate it on a 5-point scale, all Black adolescents self-rated their mental health more positively than their white peers. And so this is something that we found really interesting, that when we used this screener tool, we got a little bit more nuance. It seemed like Black girls weren't doing as well. But when we simply just asked students, how are you doing? They tended to say they were doing better. When we stratified by sex, we still found the same general outcome, although it was for a much lesser extent for Black girls. Now, moving on to objective 2, we looked at, do Black adolescents in Ontario have different mental health service use relative to their white counterparts? And this was a clear yes. Black females consistently access mental health care less than their white female peers. And those experiencing mental distress were even less likely to access care. And so they used it less, and as their distress increased, so did the gap between them accessing care. And then when it came to Black males, this was a bit more nuanced and quite interesting to me. If they had low distress, they had a much higher odds of accessing care. And so it would appear that, they have no distress, but they are being sent to mental health services. However, once their mental distress increased to significant levels, Black boys had a much lower likelihood of accessing services. And we saw the same trend for females as well. And so what I really took from this is that we cannot look at adolescent mental health service use, or even adolescent mental health for that matter, without considering things like their sex, as well as their level of mental distress. And so when we pool these estimates together, we're actually obscuring really important observations. And that really stuck out to me because previous to my research, I had seen people present research on mental health of Black populations and say that there was no difference. But it was often pooling estimates together without kind of thinking about how it might look differently for males and females, or look differently based on your level of mental distress. If you're interested in looking at objective 2 a bit more closely, I did already publish this paper in the CMAJ earlier this semester in September. So it is available for folks who are interested in reading more. Now for my third objective, I moved out from adolescence and moved into adulthood to understand how mental health outcomes and service use may have been different. So there was little difference for mental health outcomes. Black adults tended to rate their mental health poor, but it wasn't significant. However, I will say that with the adult population, we only had that single self-rated mental health question, which we saw even with the adolescents, that when we asked them one simple question around it, they tended to rate their mental health better. And for the adults, that was the only question we had. We did not have the Kessler available to us in the CCHS. However, when it came to mental health service use, there were clear differences. Black adults in Ontario self-rated their mental health somewhat similar to my white peers, as I mentioned. But when it came to use, Black men were less likely to have used mental health services at least once in the last year, especially if they were in mental distress. So as their distress increased, their likelihood of accessing care significantly decreased. And then in general, even after they started accessing care, they used mental health services less frequently than their white peers. And so there were 2 ways we looked at this. We looked at, did you use mental health services at all? Yes or no. And then among those who did use services, how frequently they were using services. And we found that all Black adults used services less frequently. And so these are kind of the 3 objectives that informed my dissertation. So overall, my research findings taken together was to confirm that Black individuals in Ontario use mental health services less than their white counterparts, despite experiencing similar and at sometimes higher levels of mental distress. And so I found the findings really enlightening, but also somewhat disheartening. So Black youth experiencing mental distress being less likely to access care compared to the white peers. It was a validating finding, but it didn't feel good either. And so as I'm kind of doing my dissertation work and writing about these findings, I often felt weighed down by kind of these kind of systemic inequities that it feels like it's really hard to change, that contribute to the disparities that my overall research findings found. And as a Black woman, I didn't really enjoy immersing myself in research that said that there were so many unfair factors kind of outside of my control that was impacting my own likelihood of well-being, or the likelihood of well-being for those I care about. I found it really emotionally exhausting. And so during this time, to kind of counterbalance this experience, I also wanted to think about ways in which I knew the Black community to be a really vibrant and thriving community. And so in response, I had the counterbalance of the experience with the Black Joy Art Initiative. And so the Black Joy Art Initiative kind of acknowledges that too often research focusing on marginalized or racialized groups utilizes this deficit approach that highlights lack or inequities experienced within our communities. And I want to complement that by pursuing a strength-based approach as well, which also highlights the strengths and resiliency that exist within Black communities. So a bit of like just, I don't know, emotional and creative response to kind of balancing things, because I really knew the Black community to be vibrant and joyous, and I wanted to explore that as well. And so maybe we're not accessing services within these institutionalized settings, but what are we doing? And so returning to my opening question, I asked, what are some hobbies of yours? Or perhaps what I'm really getting at is, what brings you joy? The Black Joy Art Initiative takes a deep dive into this question with the Black community at the University of Toronto. And so for this project, some of the questions I asked was, how do you promote positive mental health and wellness for yourself and those around you? And then how can we capture in a photo? What does mental health and wellness mean to you? What are practices that you do or have seen done to improve mental health? And how could mental health and wellness be improved in the Black community? So for this first research question, I was able to explore this using photography. And so I collaborated with Toronto-based artist Steve Williams Jr., and we conducted photo shoots where participants shared their personal interpretations of joy and wellness. One conversation that stands out is where a participant initially told us they didn't think they had any particular practice for cultivating joy. But as we talked, they realized how much caring for their plants brought them peace and wellness. It was very meditative for them. And by the end of the conversation, they thanked us for helping them recognize the simple but powerful source of joy that they already had access to in their own life. And that's the kind of impact that this project has aimed to have, creating awareness and intentionality around joy and mental wellness. So share a few photos from the project. I really love this one. It's one of my favorites. It's Sanjana, who does crocheting. Sanjana is the person on the left. And not only does she love crocheting, but she loves creating crochet art for other people. And so our photography assistant kind of stepped in for this photo, and it just captures the joy of creating and crocheting, but also gifting it to others and seeing the joy it brings to them. This next photo is of the person of Corey that I had mentioned, who really, finds wellness and meditation in just caring for their plants, and just how much care it takes and how diverse plants can be. And then I also got to participate and kind of bring in how much water matters to me, and how water is a really grounding thing for me and brings me a lot of joy and wellness. So for my final research questions, we were able to answer this through videography. And so we met with 15 folks at the University of Toronto. And these were students, faculty, staff, anyone who's Black and was somewhat related to connected to the University of Toronto. We were happy to interview. And we had conversations around what mental wellness meant to them, what were practices that they have done or have seen done to improve mental health. And we also asked how could mental health and wellness be improved in the Black community. And so I'm going to share one of those videos with you. I decided to share the second video, which is what are practices that you do or have seen done to improve mental health. And so bear with me as I stop sharing this slide and move on to sharing the video.
So I do a lot of letter writing. Journaling.
Going for sports, creating art, woodworking, praying.
Prayer.
Mercedes,
Buddhism.
I don't think we can see your screen.
Okay. I am going to, oh, you know what? Yes. I think I stopped. Sorry, 1 second. I am ending my slideshow. And I'm going to share my screen again.
Yeah, we can see it now.
Do a lot of
Okay.
letter writing,
Journaling,
Perfect.
going for sports, creating art, woodworking, praying,
prayers, meditating.
I think food as well.
Social connection is one.
Nowadays, I would say just having like pen and paper to reflect on my thoughts and my feelings. That's kind of where my wellness practice has gone now.
But I also do letter writing for gratitude. Letter writing, letters I never deliver. I want to get the anger out. I don't want to carry. I like to carry anger. I don't like to be vexed with nobody.
There are some things I just don't want to tell my friends or family, but like having that outlet to let it all out and then be able to like still keep it pretty private is something that I appreciate.
My dad did give us a journal, and he said you should write about the first year of Sinam's life, like our son. And so every day now, even if it's Monday, like Sinam was this today, and we met this person today, and we did this today. And I think that experience of doing that has been really fun and really like great for our mental health.
But prayer for me, look, it involves journaling. It involves this really explicitly kind of mental health work of acknowledging feelings and acknowledging experiences.
It feels so nice to just like be outside, be amongst like fresh air and trees, even though in the city sometimes it's not the same as like being able to walk through like a trail or something, but it's still like I think even just removing yourself from your environment, however temporarily.
So sometimes after being inside for hours, you just want to get some fresh air and the oxygen, like getting fresh air, it also helps with your mental health and this physical well-being.
But I love to create abstract paintings. And when I'm creating art, I can get lost in the process of choosing colors and how they interact with each other. And it helps me with presence and mindfulness in actually engaging in the art and being very interested in mental health, actually put the two together. And I got certified as an art therapist.
I love painting. So whenever I feel down, I go paint. I find that is what I am. And I realize that my best pieces of art are the ones associated with the worst feelings.
A lot of woodworking, bead making. I come up from a family where we make kente. So kente is this type of woven cloth that we use that you'll see in a lot of traditional wear. I see it as art because it's absolutely stunning. And it really takes a very specific skill to make.
Right now, it's trying to just do a technological rest as well on Sabbath, like turn my phone off, just zone out.
My mom would tell me all the time, like, don't sweat the small stuff. And I think I start to understand that even more so now, when there's just not the ability to sweat the small stuff. You just don't have the capacity to do it. You can't be a sponge, you've got to be a shield. And with it being a sponge, you absorb things and those things weigh on you. And even some of the small stuff can weigh on you. But being a shield allows you to sort of be yourself in whatever role you need to be, but not have those stick and absorb those will sort of fall off when you get a chance to leave those somewhere.
So every Saturday, I meet friends at church. And when we meet, we speak for a very long time.
I lime. Liming is hanging out and enjoying the company of the people you're hanging out with.
Like just having like social spaces, third spaces, that's what I say. Not necessarily work and not necessarily home. Having like a park where people can gather, third spaces, like a coffee shop, church, whatever that looks like, I think we need to have more of those third spaces.
I just generally love being around people, like whether we're just working on assignments, we're planning an event, facilitating for like a seminar or whatever, as long as I'm like with people who are like with me in like a sort of like friend sort of way, then I'm good. I think food as well.
healthy, nutritious food. I try to keep the oxtail under control. Everybody finds food. But you know, food is a central part of like when we're getting together, we're getting together around food. We're getting together with something, we're doing something with food. Like it's just rarely are we having gatherings where food isn't a part of what we're doing, and it's like a big part of it. Even the process of like cooking together, like that's the thing.
Being able to break bread with friends, with family, to share laughter, to share joy.
People in my community do things that actually help their mental well-being. So like being together, coffee ceremonies, eating our traditional food injera with our hands, and it's a table full of people around. So there's things that we do that are communally beneficial for the mental well-being.
I try to stay connected with my roots by like visiting African stores, going to community-based events like Nigerian events or African events.
I'm going on a tiki boat next week, and that's not something that I would usually do, but that's really fun. And I'm meeting other girls that I don't really know, and we're gonna all go together. And so really trying to get out of your shell as much as possible, or if you can, to experience different activities that you probably haven't done before. And as I mentioned earlier, like being able to continue to also pursue the ones that you do like.
Mostly my mom telling me, oh, you have to go for sport, it helps you a lot. And I didn't believe her at first. But then I started doing the tennis sport, and I was like, oh, okay, this kind of makes me happy.
I learned a lot of meditating techniques from friends and so on that way, and physical activity, sports and so on from friends, and you play with friends and so on, and compete.
I notice that every time that I am physically active, like I'm just in a better place mentally. I feel stronger, like there's less body aches and pains.
Sports makes you, it distracts you from a lot of stuff. And I mean, yeah, you do work on yourself, but not only your physical self, but also your mental self, because I think you shape your mind to be more competitive, to be more disciplined.
I'm a very competitive person, and so when I'm engaged in any physical activity, it's about just what I'm doing. I'm not thinking about the past. I'm not thinking about the future. It's completely about the present. Your breathing, your body, your rhythm, all of that stuff. So probably the same recipe as meditating or riding bike or motorcycle riding. You're very present, and it's just about your physical output.
I was using this website called Notion. I think they also have an app, and it kind of helped me arrange stuff. Like, okay, this is what I want to do. This is what I have to do. These are my different schedules. So yeah, Notion. Or actually just use the Outlook calendar. Helps a bit too. Yeah, I mean, you can make some little comments at the end.
Like this summer, there's like an app called Step Up. Like you're just trying to get your steps in and trying to like beat your friends. It creates a bit of competition, but like it's made me leave the house way more than I would have this summer. Had I don't know, just not did it. Like I think just the competition and like, okay, well I have 14K steps, so you have kind of thing.
Anything that I would have learned would have been grounded a lot in like faith and like religious practices.
Praying and like just being open to have people listen to you, because you don't have to go through it alone. And when you realize you don't have to go through it alone, you start to realize that you're actually like you have a community of support.
I'm a practicing Christian, so prayer, regular communal congregational gatherings, feeling that energy that comes from groups of people together. That's something I've become really attuned to in my community life, but also in music.
So I like podcasts that are like about wellness, I would say, or like just talking about what's going on with Black women, Black people as a culture. Taking breaks and not feeling bad about it. I think that's definitely like an important part about it too, because sometimes like, well, everybody else is working, everybody else is doing this. Like, why can't I just like, keep powering doing this? And it's like, no, listen to your body. Because if you don't like take the break, then your body will take the break for you. And that's when it's like even worse. So
when I worked with voodoo priests in Haiti, and I told them, do what you do. I introduced cognitive behavior therapy to them, but I always said, do what you do, and if it doesn't work, or it doesn't seem to be as working as well as it should, try this. This is an extra set of tools for you to use. It works. What they do works.
Okay, thanks everyone for watching that. So I'm happy to share that. Oh no, not again. Sorry. I'm happy to share that this all culminated in a really fun art exhibition that I was able to have throughout the month of May and June. Maybe some of you have heard of it or were able to attend. So we did. It was actually meant to be for the whole month of May, but it was really popular, and so we were able to extend it to the month of June and a bit of July as well. And there was also a really fun launch event that went alongside it. And so these are just some snaps from the launch event. And so a question that comes up a lot is, what is next? And so one thing that I have been able to do is start on a manuscript that kind of explores a lot of the themes that happened within our interviews. And so at the end, I'll share our Instagram page if you're interested in any of the manuscripts or articles that come out of it. I'll share it through that avenue. And then I also want to continue to explore this topic across the diverse African diaspora in various different contexts. And so I'm currently in the process of looking at funding to be able to expand this to just the city of Toronto. Like, what does Black Joy look like in Toronto? This project that I did this year was specific to the University of Toronto, but I'm really curious about what Black Joy looks like in a number of different cultural contexts, places around the world. I think that one of the things with being, African diaspora or a bit of like immigrant population is that we have left traditional ways of well-being in many ways and have kind of been relocated into different parts of the world. And I think sometimes we lose traditional ways of well-being. I think I may have just said that. And so I'm really curious about what are even more traditional ways in which communities have stayed well. And then through this, I was able to capture it through photography and videography, but really interested in expanding to various different art forms to capture Black joy. And so if you would like to stay connected with the project, we do have an Instagram page that is kind of the main way I stay updated. I push like new things. We might start in the new year some recruitment to do another iteration of the project. And so if you or anyone might be interested, you can follow our Instagram page at the Black Joy Art Initiative. But that's everything for my presentation. Thank you so much for your attention. And yeah, looking forward to questions and discussion. Happy to discuss the project or the research that I shared about.
Thank you so much, Mercedes, for giving us that presentation. So now we'd like to welcome questions from everyone who's here listening, attending today. So if you have a question, feel free to raise the virtual hand and request to be unmuted, and we'll be happy to respond to your question. As well, if you have questions you would like to put in the chat, you're welcome to do that as well. So as we wait for people to send in their questions as well, I think one thing I was kind of wondering about, you talked about your early research about mental health outcomes for Black adolescents, and it sounded like the results you got were kind of complicated in terms of like sometimes like worse outcomes but accessing health, or great outcomes but not accessing mental health. So I guess I'm curious, is there further research you're interested in doing to uncover more knowledge about Black adolescents and accessing mental health?
Yeah, absolutely. So not only is the what's next question comes up for like the Black Joy, but also just postgraduate life. And I am exploring doing a postdoc. I recently I'm really interested. So one of the things that came up was this idea of the Kessler and self-rated mental health questions capturing mental health in the Black community. And so we have this something called the Black-white paradox, where even though Black communities are exposed to more stressors, they tend to self-rate their health more positively than their white peers. And so there's a lot of research that goes into why that might be the case. I'm interested in validating ways in which we measure mental health within the Black community to understand if there are different cutoff values or formulas or things we need to think through when we ask the Black community what mental health looks like for them, because I think that it can be mediated through cultural factors or even just ways in which we express things. So for example, a lot of times Black youth in particular get missed when it comes to screening for mental health issues because they tend to have more externalizing behavior instead of internalizing behaviors. And so they might identify as someone, they might not identify with this idea of anxiety or something like that, but they might have aches and pains or don't sleep as well. And so if we're not capturing culturally valid ways in which different communities are expressing distress, we might miss them, and on a population-wide level, kind of like miss opportunities for resources. And so to answer your question, I'm really interested in validating and thinking through the ways in which we assess and measure mental health for the Black community. Yeah, that's a great point.
Thank you for that. Yeah, I saw while we were talking, yes, Anya, I think also can
Hi. Hi. I was curious, it's kind of related to what you were just talking about, but specifically about like traditional mental health services. Um, I was wondering like what kinds of um research has been done or like is like people are interested in terms of what makes what parts of like the traditional mental health services maybe aren't um servicing Black people like as well as other people, or like things that make it less desirable or accessible, and like how to make it more appropriate for the different needs that they might have, aside
Yeah,
from like
yeah, that's a great question. So in the third video, folks kind of explore that a bit when it looks like what could be done to improve mental health in the Black community. A really big thing that people brought up was having mental health care practitioners that reflect them. And so folks may be feeling like either mental health resources are not necessarily available in their community, in the communities that they are, or they're not accessible. They don't reflect the community. And so I think, you know, if you're experiencing racism or things within the Black community, it can be a lot of work and burden on a person to kind of explain their experience, or even feel like they need to explain their experience. Not necessarily that a practitioner doesn't know or understand your experience. And I think a level of comfort that would come with more culturally diverse practitioners. I will say that, like in my experience, it hasn't always been Black counselors I've connected with the most. I think for me, it's been like maybe racialized from a number of different groups. And there are a lot of things that make someone a good fit for a person. And so race can be one of them, you know, sex, religion, experiences, all these different things can be good fits. And when folks are looking for mental health, or when people in my life are looking at mental health, I would often say that, you know, the first counselor you see may not be the best fit. It's kind of like dating around and seeing who's a good fit for you. But if folks are not even seeing themselves at all, then it reduces the likelihood that they're able to get a counselor that understands their needs, or that they feel well connected to. And so I think a solution for that is just, you know, improving the pipeline to counseling and to mental health practitioners, so that we have a diverse array of people that are serving, so that people are better able to connect and meet with providers that they feel comfortable with. Because among the Black population, at least with women, we saw that they are accessing services at least once in the last year, but what's happening is they're not continuing services. They're not using it as frequently once they walk in that door. And so it really makes you wonder what's happening, what they're experiencing, that they're not engaging as often. There's also there could also be financial barriers, a number of other ways in which we can improve access. Blue sky thinking, but you know, I would love a world where mental health is also covered in our primary care. And so just like how OHIP covers, you know, our physical health and doctors checking in, I'd love that to be something that's covered for mental health as well. That way there isn't a financial barrier to accessing mental health services. And finally, I'll say, just because a practitioner is not from ethno-racial community doesn't mean that they can't provide good care. A lot of assumptions goes into the way in which we treat patients as well. And so there are trainings and things of that nature to think about how we can provide more culturally appropriate care, even if we are not of that culture. Just critically think through kind of the assumptions we might be making, or different ways in which mental health issues might manifest for different communities, because research indicates that they can manifest differently based on someone's racial or ethnic cultural background. Hope that answers your question. I also saw in the chat that someone asked about the article for Objective 2, and so I also dropped that in the chat along with a podcast that I was able to do with the journal on it.
Thank you for the answer and for sharing that article as well. I noticed in the chat we have a question from Brenda asking, Dr. Sobers, have you found in your research that Black diasporic communities can be trained in mental health awareness, knowledge, and skills around risk and protective factors for optimal mental health? Now, you have any insights with regards to that question?
Yeah, so yes, there are a lot of initiatives happening. One initiative that comes to mind, and I'm not immersed well enough in like all the initiatives to give a fulsome, but one that I know is that barbershop workers are currently being trained to kind of provide some level of mental health support. There is an initiative, I think it's connected through the Black Health Alliance. I believe that's the organization. They have this program where barbershop workers are kind of being trained to talk about mental health and screen and maybe connect people to resources, because I haven't gone to a barbershop, but my understanding is, folks who do get their hair shaved, they have a lot of really great conversations, and I can relate to that from a hairdresser perspective anyways. And so that's one way in which, generally Black men, but anyone who goes to barbershops really might catch might be able to have some conversation on mental health and ways in which training is happening. And I'm sure there's many other initiatives that are happening within the community. I'd say the community has been aware of this issue for a while and have kind of done a lot of grassroots work in order to address mental health within the community. Thanks for that question.
Thank you. That's a really fascinating example. I'm curious to know more about barbershops and mental health. Yeah.
Yeah.
So one other question we have in the chat comes from Xi Mali. And they ask, let's see how to phrase this question. You could argue through, I'll just read out. You could argue.
Sorry about that. Yeah.
You could argue through your Black Joy initiative shows how community and culture can like to more positivity and mild mental health. But did you have answers for more severe mental health challenges? Is it fear of accessing mental health services or something else? Is there a larger expectation that we, Black diaspora, will rely more on friends than on services? Any thoughts on that question or those thoughts there? I think
Yeah. So I think what I hear, and thanks for asking the question and typing it out, even though you're in a library. Yeah, I can't speak very loudly or speak at all, I guess. I think what I'm hearing is that, there's a lot of things in the Black community that's addressing these kind of milder challenges. But then when it comes to larger issues where we need professional services, how to address that, and what is the fair. So I think I'll say that within a Canadian context, we know that Black folks are more likely to experience racism and negative experiences when accessing care or navigating the system. And these experiences make folks much more reticent to even access something as vulnerable as mental health care. There can also be previous negative experiences with mental health care. And even if you yourself do not have a racist experience, these are things that are spoken about in the community. And so you don't have to have this experience to kind of have this visceral feeling about the experience or fear about experiencing that. And so I'd say just the historical experience of racism has really shaped how people approach the mental health care or how willing they are to engage in mental health services. I'm just going to read your question one more time just to make sure I'm capturing everything. So yeah, I do think a lot of it has to do with fear of mental health services based on previous experiences. I also think that because of the historical experience of Black folks not necessarily having access to mental health care, being more economically disenfranchised, we've just created alternatives to mental health services or to some of these more professional routes of care because these standard routes of care has either been harmful or just not accessible to us. It hasn't been an option. And so there is more reliance on community and a lot of the things that was shared in the video because these sources have not been very accessible, but it doesn't mean that these sources are not helpful. I think that if you have, a diagnosable like disorder, friends, family, faith is only going to go so far. Sometimes you need medication or professional counseling. And so it's definitely a disservice to the Black community if they're not able to access these professional services. I hope that answers your question.
Thank you. And I see we have another hand raised from Hafsa.
Oh, hi. So I run traditional Somali dance lessons for young girls, and I've seen the difference in when they walk into the room and when they leave, and also when they start our program and when we're like ending it. Um, I want to record and maybe do research on this, but I'm not really sure where to start. So if you can give me some advice, but give me 1 second, I'm gonna connect back to my headphones because I can't hear through my phone. So just give me like 2 seconds.
Yeah, I'll give you two. Maybe give a consent for it. Let me know once you're connected.
Hello?
Hi. Yeah, so you talked about, oh, can you hear me?
Yes.
Okay. So you were saying that you want advice on how to kind of capture what you're able to do with through Somali dance with the girls that you're teaching?
Yeah, exactly.
Okay, great. I feel like this could, so I'm also like a bit of an evaluator in the background. And so I think there's a lot of different ways in which this can be approached. But, I like how you're able to see a difference with the girls. I'd be curious about what their experiences are and what they'd be able to share. And maybe it could be, capturing these experiences through video or photograph. So I think someone might be having some background noise. And so that could be, through the Black Joy, we did photography. We asked people directly about it. If you wanted to do something where you wanted more funding and to really advocate for how impactful this is, then I would say some sort of evaluation where you're able to ask people as they leave the program or even as they're involved in the program, the impacts that it's having on them on a number of different metrics. Then that can be used to kind of show the impact of your program and ask for maybe a bit more resources in order to expand that, as well as holding a critical lens. And so looking at ways in which it can be improved as well. And so that way you can always kind of cater things a bit more to show how you're improving and really emphasizing positive impacts that you're having and kind of mitigating anything that might be barriers for them. But I also feel like this can be like a whole hour conversation, a whole evaluation plan. And so if you are interested in chatting further, you can definitely connect with me through the project Instagram page, which I'll share and more than happy to have a further conversation. And I've shared that in the project Instagram page if you want to connect. I think I shared it. Yeah. And I also shared in the chat based on a previous question, a YouTube video and an email around the self-care through hair in barbershops.
Thank you for that, Mercedes. Now, since we're getting to the end of the time now, I think we can wrap things up. So I want to say thank you again for such an insightful presentation and for taking the time to answer so many questions. And thanks as well to everyone who attended today and showed such interest. Our next Knowledge Cafe will feature Alex Ramiller of U of T's Department of Geography and Planning, and we'll talk about alternative conceptions of home ownership. So we encourage everyone who's here today to show up to that as well. Finally, please consider subscribing to the School of Cities on all your favorite social media channels. To explore those, please visit our link tree, which I think Asta has posted in the chat today. So Mercedes, thanks again. I hope. Oh,
Are we all getting the emergency alert?
Well, what an ending with that. So
All right.
thanks again, Mercedes. Hopefully your joy is way up now that the weight of the PhD is lifted from your shoulders and
Yes.
you can celebrate. So congrats again on that as well. And thanks everyone. Have a great afternoon.
Thanks for having me.